Tell us a little bit about that.
So I run women's outpatient services as well as including zero exposure. So we work with women in all different levels of treatment, day treatment, outpatient treatment, intensive outpatient treatment. And then the zero exposure program, we specifically work with high-risk pregnant women because of the addiction issues. And the goal is that they attend all their prenatal appointments and have a healthy baby of that program.
So if they are in the program, the methadone program, or any other medication that they might be administered, is methadone the only one that is given to pregnant women? I should ask that question.
I believe Vivitrol is approved for pregnant women now, but I'm not 100% sure.
Okay.
But usually methadone, yeah.
Okay, so with the methadone-assisted therapy, if the woman has been on opiates, then methadone is a treatment.
Yes.
And it's administered safely during pregnancy. Can you talk a little bit about that?
Yeah, and so the women come in, if they're addicted to opiates, methadone is the treatment of choice, and basically that's to help prevent the spontaneous abortion of the baby. So they can't just stop using the opiates. They need to be on something else. And we can monitor their dose when they come in versus using street drugs. Also, it helps them to prevent child welfare involvement. And it's safe to breastfeed with once they have the baby. It actually is minuscule when it comes out, so the moms can have that bonding experience with the babies.
So how does the doctor monitor the baby to see how things are going during the course of treatment?
The Dr. Fields runs a pregnancy clinic, and we do it once a week. He meets with the women that are enrolled in the methadone program, and he sees them. He does birth weight, and we coordinate care with the OBGYN. So the client will be enrolled in our zero exposure program. Then we will send a letter saying, hey, to the OBGYN, we are working with this client as well, and we'll get a consent signed for them, and we monitor their OBGYN records through that collaboration. The case managers do. So we make sure everything's good. We get birth records afterwards and all that kind of stuff as well.
Now, during the course of the pregnancy, is there any type of lab work that happens with the pregnant mom that monitors the methadone, or no?
Yes, they do check the levels of the methadone, but I'm not exactly sure of how often that's done. I think it's individualized.
Okay. So tell me a little bit more about what your staff does with the moms and during the course of the pregnancy and in the DACO program.
Sure. So the client will come in for an intake, and we do a case management plan of care where we look at long-term and short-term goals related to the pregnancy and the substance abuse. We, of course, encourage them to do 12-step meetings, and we do supportive counseling as well as provide the referrals. We have some incidental funds through the Children's Board and also through Central Florida that we can use to help parents get the items that they need once the baby is born. We can drive them in the DACO van to appointments at the OBGYN or anything else that's related to the pregnancy and family stability, really. For instance, if they need housing, we can take them to a housing appointment. So we meet with them at least once a month, usually more than that, to make sure that everything's going okay with the pregnancy. We educate them on NAS, neonatal abstinence syndrome, and we provide baby showers for them twice a year that they can come to and get different items as well, which is really fun.
Okay. How do most of these moms come to know about DACA?
That's a good question. We try to have good relationships with OBGYN, so sometimes we'll get calls from the OBGYN saying we have a pregnant client that we would like to refer. I think most people in the community kind of know what we do here, and then once they are enrolled in a program, they then have the opportunity to they could dually enroll in multiple different programs. So they could come in for methadone, but then we could recommend a higher level of care, and maybe they go to residential, or maybe they do outpatient, which is more intensive, and maybe they do case management. So we try to provide that wraparound service once they get in the door.
So sort of assess them for everything they need to make this work for them.
Yeah.
In the course of their treatment. How long does how long can they stay with you after they deliver the baby?
They can stay in the zero exposure program for up to a year postpartum if they need it. Average stay is about 3 months postpartum, because usually at that point they've gotten all the services and referrals that they need and they're ready to hopefully move on and stay sober in their life.
Can they come back to you if they have problems later on?
Sure. Yeah, we always have an open door policy for them. Actually, we have a maternal health suite, which we want it to be like a one-stop shop for anybody that's pregnant. Even if they're not a DACO client, they can walk in and it's labeled as the maternal health suite, and we can provide them with resources even if they're not a DACO client for things that they might need.
Did I notice that you have a building to the right of your main building that's a Head Start building?
Yes.
Can you talk a little bit about that program?
We have a child care. It's a learning development child care, actually. So all the children in it are given ages and stages questionnaires to monitor the different developmental areas and make sure that they're on target with that. And we have also in there Healthy Start and Early Healthy Start classrooms, so they're able to have that advantage if the clients need it. They also provide our parenting classes here for the clients. So Champions for Children is, they run that daycare, and then they come over and to our Women Provide Nurturing Parenting programs, and actually to the men and men's residential as well.
I know sometimes folks have co-occurring disorders. They have mental health issues. Do you screen and provide services or referrals for mental health issues?
Yes, we provide, we try to, like I said, provide wraparound services. So if someone's identified with mental health issues, we do have addiction fellows that they're able to see and get medications to help with those, to help obviously prevent relapse, because we know that they work hand in hand. And then they can follow up with them throughout the course of treatment here. So not only do they see the doctor, if they're on medication-assisted treatment, they'll have regular appointments with the doctor to monitor that, but also psych appointments with the doctor to monitor the psych stuff. So those are done separately.
Okay. Is there anything maybe I haven't asked you that you think would be helpful for folks to know out in the community about DACO or in your program here?
I just think that we have a really good team of people that try to work really well and make sure the clients are not just treated with medication, but also given the therapy that they need, and lots of different programs, which is unique to DACO because there's lots of places where you don't have the opportunity to go to detox and go directly to residential and also be in methadone treatment and all those different opportunities. So I just think it's a great.
I think sometimes some of the terminology people are using now is treating the whole person.
Yes. Yeah. And we have the ability to do that. So it's really cool to be able to.
So it's not me.
Okay.
So we treat the whole person.
Yeah, we treat the whole person here at DACO. We try to take a holistic approach to things.
That works.
Okay.
I like that.